When it comes to saving lives in emergency situations, every second counts.
Well, there's a first-of-its-kind program here in Utah. The West Valley City Fire Department can now provide blood to trauma survivors in need.
Mika is live right now in West Valley with a closer look at how the new tool is working just months after launching. Good morning, Mika.
Hey, good morning, guys. Yeah, that's right. It launched back in November. And now this program is in partnership with Intermountain Health. It's the first pre-hospital whole blood program in the entire state of Utah. And joining me now live to talk more about it is West Valley City Fire Captain Aaron Kissel. Thank you so much for being here this morning.
Of course, of course.
Briefly explain what exactly this program does.
So this program brings the capability to do a blood transfusion for a patient in hemorrhagic shock to the field. By bringing blood to the patient, administering it earlier on, we can prevent the patient from going into a more severe grade of shock. They spend less time having to be resuscitated before they can go into the OR and ultimately receive the exact treatment that they need there. So it's saving lives by giving them faster access to replacement of what they've lost.
Sir, can you hear me?
And faster
Racks are
intervention
setting up
times.
blood.
So since launching in November, you know, how many times have you used this and what have you used it for?
So we have used the blood 5 times in 3 months. So, and we have used it for a variety of patients. A few have been for gastrointestinal hemorrhage. We've used it for a postpartum hemorrhage, and we've also used it for a post-operative hemorrhage.
Can you show us how it works? I know we
Yeah,
have a
of
close-up
course.
look here.
So this is called the APRU. It means Autonomous Portable Refrigeration Unit. Think of it as like a little Dometic camping refrigerator, but to the next level that you could think of. It is placed on our supervisor vehicle. If a blood call comes in, he will respond with the crew or to the scene with the blood. It can then be removed from the vehicle. All of the indicators and everything like that are on the front. The blood is kept in here, and then of course on the top flap there we had the blood warmer. That is to warm the blood as it's administered to the patient. And inside, if we just kind of open up the cooler, we can see our emergency release forms, and we also have our blood. And every morning our battalion chief, our supervisor, will do a check of the blood. He'll record the temperatures, which are done around the clock for Intermountain as we steward this blood. And then on a rolling weekly basis, the blood is exchanged for another unit so that it can get placed back into the supply at the hospital and used to either be administered to a patient or turned into components.
So it's safe to say that this program is saving lives. It was a pilot program and it's wrapping up
Correct.
soon, right?
Correct, yes.
Do you folks plan to continue to utilize this, and do you think there's plans to expand it as well?
Absolutely. We intend to continue doing this program. It's proven its merits from the very, very first administration. It is definitely something that I see other agencies throughout the states that they have expressed interest both to us and to Intermountain and to their other neighboring hospitals as well of getting this program up and going.
And lastly, are there any challenges or maybe downsides to this?
As far as challenges, the biggest challenge that there really is that, again, the blood itself, once it leaves the body, is only good for 21 days in that bag. So making sure we do not waste any of that blood is paramount to us. We want to be good stewards of it. We want to make sure that it's getting used. We want to make sure that this is a resource that patients always have access to. So taking the utmost care of it that we can and then exchanging it with the hospital on a timely basis and never having any waste is the goal, is the standard.
A balancing act.
Yes.
Well, it sounds like it's doing great work 5 times in the past 3 months. Definitely shows a need. Captain Aaron Kissler with the West Valley City Fire Department, thank you so much for your time, for showing us how this works. We really appreciate it. And guys, coming up in my next hit in the next 30 minutes, we are talking to the West Valley City manager about some new developments coming up here. And also he has some ties to the Patriots with the Super Bowl coming up. We're going to be talking all about it.
Okay, and with the first aid there. We're going to learn CPR. We're going to have a live demonstration on how to perform CPR, all the latest techniques a little bit later too, maybe before. Thanks a lot, Mika.
Oh, great.
Yeah, Mika, appreciate that.